And we're back for another video with State Senator Lucio of Brownsville. Many people will know that the medical school we have here in the Rio Grande Valley, run by UT Rio Grande Valley, was set up in the last decade, but the preparations for that medical school, a lot of the groundwork was done in the 1990s. And who better to talk about that than State Senator Lucio, who played a key role in the very early days when a lot of people said, no, the Valley's not going to get a medical school. Tell us about those days, Eddie.
Well, first of all, in 1990, Steve, in 1990 we only had one senator in the Valley, one, and that was one district that covered 2 counties, Cameron and Hidalgo. That was it. Before the year 2000, when we had, a new count of people in the census and all, and we changed it. We got another Senate seat, but so we operated with one senator back then on the Senate floor. The other senator was in Corpus Christi, and that's another story. But I was able to when University of Texas System came to me, they wanted to be part of the Valley. It meant a lot of money to the system, Steve. It meant millions and millions of dollars, federal dollars, that would come to us because of the number of Hispanics that were available to become part of that system. And I was elated to carry the bill that created the University of Texas System in the Valley. Back in those days, with Chancellor Cunningham was the chancellor at UT, and wonderful man that I had incredible, wonderful memories working with, and he was the one that went to work on my request to make sure that the medical school that was going to be created here in the Valley was Valley-wide. Already I had felt a little tension between the East and the West, and of course the middle was Harlingen. But I talked to him. I said, look, I want the people to know that this is a Valley-wide endeavor and a project that will bring a program that would be Valley-wide. So he invited me to attend a very special meeting of the Board of Regents in Houston. And when I got there, the meeting started, and I was called up, and he said, well, Senator Lucio has been wanting, for the Rio Grande Valley, and of course the University of Texas supports it, and we have triplets for the senator. And he said, we have the School of Research in Edinburgh, the School of Medical Education in Harlingen, and the School of Public Health in Brownsville, UT Edinburgh, UT Brownsville. But it all came back together later on when it was just one UT system, and not at here or at there. And that was the start of it. We were affiliated with the Health Science Center in San Antonio. All the budgets that we worked on, the budgets were handled through San Antonio. But it was my duty and my job to do everything I could to make sure that we got the funding necessary. And that's where Bob Bullock came in, and he was, obviously he supported the Valley. Thank God for that we had a lieutenant governor back in those days. So that's how it all got started. Later on, we're blessed today to have 2 university systems in the Valley, as we all know. But Texas took center stage in the 1990s, and we were able to accomplish a lot of and establish a lot of programs that had only been dreamed about in the early years. So I sit here with a great sense of accomplishment, but it took a team of local doctors, business people, educators, people from all walks of life who were part of that team back in the 1990s, with just one senator. And we had a delegation, a wonderful delegation that I was able to work with in the House of Representatives that did their job in the House side. So we were very fortunate.
We should say at this point that the first efforts to bring a medical school didn't actually start in the 1990s. If we say that, people like Randy Whittington are going to be very annoyed, quite rightly, because the first bill was actually in the 1940s.
Yes. Oh, it had been looked at before. That's why all the talk at the federal level, well, you all want a veterans hospital, but you're not going to get it until you get a hospital, a medical school. So we've accomplished that. Now I'm waiting for the federal government to bring down a veterans hospital for the sake of our veterans. We have tens of thousands of veterans, men and women, who served our country with dignity and respect, and we should provide we should make every effort to provide the necessities for them when it comes to medical education.
So on the
medical and healthcare delivery.
So on the subject of the Veterans Hospital, you still think that's on the agenda?
I don't. You could do. There's other options. I know. I mean, I don't see why we can't give them all a credit card and let them go to the hospital of their choice. And let the federal government reimburse those hospitals. I mean, it's not a how can I say, a brain buster. It can be accomplished, and I'm kind of I don't know why they haven't done something as simplistic as that. I think that they should. I think every veteran should have a credit card, and they should go check into any hospital, clinic, anywhere they want to be able to get the services they need.
So going back to the medical school and the groundwork that you were laying in the 1990s, tell us a little bit about the sort of hostility, the opposition you got back then when people said the valley couldn't sustain it. You don't have the residency programs. You're just not mature enough.
That's everything that you just said, Steve. Is exactly right. There was some non-believers, unfortunately, but the believers, made more sense, and they motivated me to a point where I didn't sleep at night. There was one doctor who vehemently opposed the medical school project that I had, and he was a doctor out of the Upper Valley. Don't recall I think it was Dr. Ansaldúa. What was his last name? Don't recall his first name, but he had been in the paper. He came out publicly against it, and funny thing happened at the same time. He was appointed by Governor Richards to be on the State Board of Health, and I told him that I would not confirm him, and even if he had 30 other senators in the Senate, we're 31, he couldn't serve because the tradition in the Senate is your senator has to approve you first before you even get a vote. If your senator's not with you, you don't serve. So I told him I couldn't support him, and he obviously was extremely disappointed. But I was disappointed too, because he had come out publicly against the medical school. We had enough doctors, which was just, for lack of a better word, was a flat lie at the time. We were in dire need of doctors and teachers and other professionals. And so he was at the Capitol, I think, during the course of a week, and then he finally came in begging me and saying, "Look, I'll support your medical school. I'm sorry, I need to serve." And And I know Governor Richards would have gone somewhere else, some Corpus or Laredo or somewhere else, and chosen someone for that very important position. So I said, I believed him, and I said, you know what, I'll work with you. If you support me, I'll confirm you. So I confirmed him. And then another funny thing happened. About a week later, another article in the paper, he came out against the medical school. So I lost faith in people's words. I couldn't believe people at times because of that incident. But here we are in present day, and we're happy as a lark. Everybody is. The medical school's doing beautifully. It got to this level. Now we're part of regular funding that comes to medical schools in Texas. It is a wonderful feeling to know that children that were born and reared in the valley are now going to that medical school. And one of them just happens to be my grandson, who, quite frankly, didn't need Grandpa to get into school because his grades were absolutely awesome. Just straight A student, and I'm so proud of him. As a matter of fact, his first semester in medical school, he says, Grandpa, I got to tell you something. There was 100 people that took a test, and only 5 got over 90. And Grandpa, I was one of those 5. I said, son, you're well on your way. Then I walked away and wept. That was a beautiful moment in my life.
I can't really ask if there's anything else you'd like to add on the medical school front.
Just support your school. You know, generations to come, it should be even stronger and stronger. And someday I hope that we even become part of this hemisphere that we live in this part of the world. I would love for our schools to be called UT Las Americas, because it deserves to be more of a, not just a regional medical school, but a world medical school. UT Las Americas would really give it the lift that it needs to be recognized worldwide. And that's what it'll become, a worldwide institution because of that name, Las Americas, the Americas.
But also because of the people working in it.
Of what now?
It will become worldwide in
Yes.
recognition because of the faculty, the staff,
Exactly.
the leadership.
Exactly. So there's a lot of good things ahead, and I know there are a lot of great leaders yet to be born. And as we continue our cycle of life, others will come when our cycles are ended, and others will lift this medical school, this university, our institutions even to a higher level. I'm convinced of it, because that's the way it should be. That's the way it will be. If we continue to have a society of people that care, compassionate people that haven't lost their moral compass, that believe that in a deity, that believe that we are truly a nation under God. I think we're heading in the right direction.
Senator, thank you so much for today's interview.
Thank you.